Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. On today's episode, I am really excited. We have Satish Movva with us. He is the CEO and founder of CarePredict. A couple of things that I want to share with you that makes this episode really exciting is that they were recently noted or slated on the Digital Health 150 list as one of the most promising digital health startups. And then also recently, let me make sure I got this right. You guys were just awarded the CES 2020 Innovation Award honoree for wearable technology development just for seniors. Congratulations.
Thank you very much, Dr. Modi.
And welcome to the show.
Thank you.
So I think I'd like to just start off with you telling us a little bit about your background and what you do for our listeners who don't know you yet.
Yeah, so I've been in technology now for about 30 plus years, and 26 of those have been in healthcare technology. So I've been in very large provider corporations, physician corporations, all the way to working with folks like IBM. Throughout my long career in healthcare technology.
Okay, nice. And so a little bit about CarePredict and what you're doing there?
Yeah, so CarePredict, I really started CarePredict primarily to take care of my own parents. My dad's 94 this year and my mom's 84. They live about 10 minutes away from me and I speak to them every day. But when I show up on a Saturday, along with my kids in tow, I almost always find things that were completely new that I had no idea about. And more often than not, that led me to take them to the ER that day or pretty much mess up my following week's work schedule, just to get them specialist appointments. And I really was looking to see if I could get some idea about what was going in their life, because the unpredictability in their health was causing havoc in mine. And that's how I came about to create CarePredict, to essentially give me that heads up about what's going on.
So I think that's fascinating. And I think I told you on our pre-call, I want to buy one of these. I need a couple of them.
Absolutely.
So describe what it's like to be a healthcare entrepreneur today and a pioneer in this space.
Yeah, I think there are a lot of really smart people looking at this issue. You know, worldwide, the number of seniors are growing at a tremendous rate. The number of caregivers who can care for them and the number of payers who can pay for the care has been decreasing quite a bit because we're all living a lot longer than we expected. So a whole bunch of very smart healthcare entrepreneurs are looking at this. I think they're coming at it from multiple different ways. Somebody like me coming from within the industry are trying to fashion a solution that fits into the current workflows of the physicians and the current healthcare system and can fit into that reimbursement model. And some of the other entrepreneurs coming from the technology side out of the valley are coming at it from this really nice technology. Is there an application in senior care? So both of those are coming together and dovetailing together to really create the best in breed solutions out there for technology for aging seniors.
Mm-hmm. Yeah. And I think that it's great because that's, I think, what's going to help transform the industry is the convergence of those two mindsets. So do you have experience in other verticals in your past career?
I have, actually. I started out actually as a very deep technologist. I was working on operating systems and networking, kernel stacks and things like that for IBM. And then I went on to work with IBM in different verticals, in insurance verticals, as well as law enforcement verticals in Scotland and New Zealand before I came back into the healthcare system here in the US.
So how would you, what would be some of the differences, or how would you describe what it's like to develop and innovate technology in other verticals compared to healthcare today?
I think I would say that healthcare has always lagged other verticals in adopting new technology, mainly because it's the kind of problem. We are dealing with real lives, real people, and people are always going to be a little bit more conservative in how they adopt new technology. Mm-hmm. Whereas in some of the other verticals like law enforcement or insurance, it's very much a dollars and cents equation. They're looking at return on investment and they can deploy it very, very quickly. There aren't any bad consequences there. Whereas in healthcare, there could be bad consequences if you get something wrong.
Yep, absolutely. It's interesting. There's a lot of lip service going on about healthcare innovation, and everybody's talking about it. So it seems like for the level of talk that's happening, it seems like there's a lot of adoption. What's your perspective on the difference between talk and adoption?
I think that's very perceptive of you, by the way. There is a lot of hype around digital health and a lot of innovation going on. I think the way to look at it is, how many of those really get out of the pilot stage where they're proven to have a true return on investment and have the efficacy that people are looking for versus, how many actually get into commercial and come all the way through. There's a large drop off right from pilot to actual commercial in the digital health space.
Sure.
Because a lot of the new innovators that are coming in not necessarily with the domain expertise of health, but the domain expertise of technology. Yeah. And sometimes what they think will work in this space doesn't. You cannot make a round peg fit in a square hole.
Yeah, absolutely. And I would just add to that. So you were talking about those two segments that are kind of coming together. So you've got those technologists that may not be familiar with the domain of healthcare. And then you've got those folks in healthcare who have lots of expertise, right? A lot of times they're living with the problem that they're trying to solve. Right. But often they get so in love with their solution, they think everybody's going to love it just as much as they do, right?
Yeah, I mean, that's every founder you ever speak to will believe their solution is the panacea and sliced bread, but you really have to let the market decide that.
Sure.
And the market is the ultimate, judge and arbiter of this. And you can tell how many of these digital health platforms have been adopted and have gotten to commercial success versus those that haven't. And that's a very clear indicator to you, what is working, what is not working.
Yeah. So help us understand what has been your process for developing your early adoption strategy.
Yeah, so when we started this, I was trying to really build a solution for people like me, adult child of a senior, really struggling with their parental care. So it was more targeted towards consumers. But along the way in 2015, we realized that trying to put this technology in hundreds of homes is something that at our stage was not scalable. As a startup, we cannot go to 100 different homes and support 100 different seniors and have eyes on 100 different seniors to understand how the device is performing versus their own, activities and behaviors. So we somewhat pivoted the company to say we're going to go after senior group living, which is independent living, assisted living, Alzheimer dementia care centers, where there are 100 or more residents in a facility altogether, and you have 30 to 40 staff that are there to take care of them. And what that gave us really was a very controlled environment where we could deploy our product and actually measure how well it's working, because we had the staff there who had eyes on the residents, and we can compare what they are saying versus what our device is saying. And it also allowed us to send our nurses into the facility to collect data, to label our data. We use AI extensively in our platform. But for you to do AI correctly, you need what is called labeled data. Yeah. So you know when somebody fell. You need to know when somebody had a urinary tract infection. You need to know when somebody was depressed. So you could train your AI training, deep learning training models to know, well, these were the initial conditions that led to this consequence, that labeling of the data, that fall. Being in that senior group living facility really allowed us to do that extremely well. And I look at my peers out in the industry that kind of went out after the consumer model first. They were all struggling, and they are still all struggling because it's not scalable to deploy it in mass quantity and see how well it works. Whereas in a controlled environment, you have really good, and most importantly, you have the same group of people going through the facility. and you have this long-term ability to look and see how your product is changing them, changing their activity behaviors, and is it really truly making a difference or not?
So I want to pause here and really dig deeper into this, because I think that this is a topic that is so important to innovators, to our listeners, that very often there's this decision between B2B or B2C. And a lot of folks that I talk to, they want to circumvent the bureaucracy and the red tape, right, of reimbursement rates and go straight to B2C and feel like, hey, I'm just going to do some Facebook ads, and I'm going to expand and get this market, get this adoption in the market. And so help me understand what you're saying on what you decided and why you decided it early on. And then what was the thing that made you pivot and change?
Yeah, I would say that you're absolutely right. And there's a whole lot of people going after B2C, just trying to get engagement through Facebook ads and so on. But I think I would differentiate that by saying there are certain pieces of technology that are maybe only software, mobile apps that may benefit from that route. But if you have any kind of a wearable device or any kind of a hardware component or something that's a little bit more sophisticated, that requires essentially a curated introduction of that product, B2C is not going to scale for you.
Mm-hmm, mm-hmm.
And you can spend a lot of money, getting a lot to acquire consumers, whether Facebook ads or whatever. Those things add up pretty quickly.
Sure. Yeah. And it's not cheap.
Yeah, it's not cheap. And kind of roll that out all over the country or in geographical region or whatever, but you're going to be like a pinball going to all these places trying to figure out what's going on.
So do you think that that's because it's the early stage of the product development and you're still trying to prove the safety and efficacy of the solution?
Even prior to that, it's the product market fit. Does the product really address the question or not? Mm-hmm. And you will not know. In your mind, it may absolutely address it to the nth degree, but until it's in the wild on somebody's wrist or on somebody's mobile phone, and they tell you that honest, candid feedback, it's only in your head. Yeah. And that very early segment, that very early adopters, the 40, 50, 80 people, are going to shape your product for eternity. Not necessarily for eternity, but at least for the next couple.
Right.
Because they are going to tell you what works, what doesn't work. You may go in with the assumption, everyone's going to wear my device. Well, then you're going to find out, it's too big, or it's the wrong color, or whatever it may be, like we did originally with our very, very first versions. And that allowed us to refine the product market fit. And the early adopters are the ones that are going to shape it. And you want that to be a very diverse group, but you also want that to be a controlled environment. So you can repeatedly iterate on the product, take it back to them and say, now does this fit your conception of what this thing is supposed to be? Yeah. And all while you're measuring the functional aspects of the device or the software as well to see, is it really changing or making the changes in their health that you thought it would?
So I think that I almost want you to repeat everything you said, but I won't have you do that because I just want to reinforce it for our listeners. So it sounds like what I hear you're saying is you're not saying that, you or the company won't ever go to B2C, right? You're just saying that is not your initial path, that for the reasons that you just described. So it's maybe still part of your phase 2 or longer term adoption strategy, but doing B2B right now because you have a device with an app and you need to prove safety and efficacy and you need to prove product market fit.
Absolutely.
First, with exactly the B2B.
Yeah. So we launched the pilots in 2015. We ended the pilots in 2017. We had 2 years of solid data. And then we started commercially offering the product in senior group living, both here in the US and in Japan. And it's been very, very successful. So we're all over the US now. And in fourth quarter of 2019, we actually launched the product through home care channels into the person's homes. So that's our B2B2C. Again, you're taking that distribution channel, you're taking that person who has hands and eyes on that individual 3 or 4 times a week, deploying it through that channel. So you're giving yourself the scalability of the channel. That's super important. You need to be able to use an intermediary to get to a couple of hundred consumers, not directly sell to the consumer because it's much more expensive. That said, because of the award at CES that we received in January for the innovation in wearable technology, we actually also deployed our product to direct to consumers as well. So we have a beautiful retail kit that's designed for a senior living at home. And you can purchase it right on our website and very soon on Amazon as well. And the intent really there was, and we're not yet doing any kind of massive advertising or anything about that product because we want the home care channel to prove out that it works really well in consumers. And then those early adopters in the direct-to-consumer who have such a pressing need that they're scouring the web looking for technology like ours, when they come to us, they're going to see it. These are the early adopters you want because they're motivated. They want to try it out. They're also forgiving if there are any flaws in it because they're going to help us change it, iterate it, fix it. And so it's a very soft launch, and you always should do a consumer thing as a soft launch because there are going to be questions that you have to answer, and there are going to be problems that you did not anticipate that a consumer will find. I mean, so much variation out there in the world of consumers, you're going to have unexpected things brought to your attention, and you will have the room to make those changes, refine it, and then do the big launch, around Mother's Day or some other big event.
Hey, it's Dr. Roxy here with a quick break from the conversation. Do you want your innovation to succeed, to change lives, to shape the future of healthcare? I want that for every health innovator, which is why I invented COIQ, an evidence-based framework to take your innovation from an idea to startup to full market adoption. If you're not sure where you are in the commercialization process, take the free assessment now at drroxy.com/score. Don't miss out on impacting more lives just because you have a low COIQ score. The free assessment is at drroxy.com/score. That's drroxie.com/SCORE. And now let's jump back into the conversation. And I think that it's even more important with a complex buying process like healthcare, where you've got, a buyer, and then you've got maybe a sponsor, and then you've got the user. I was talking to someone the other day that, is doing something in the home. It's not like Care Predict at all, but something to where they've got folks like you and I that are the actual buyer, but then they've got a senior person that's the user. And like you and I, they were all over it. They were buying it. But when it came to the person using it, they didn't like it. And so, being able to identify product market fit, which each person that plays a role in that buying cycle is so critical. And it sounds like that's what you're talking about.
Absolutely. That's exactly what I'm talking about, because it's the user is different. So in senior group living, you have 100 people wearing our device. You have 40 staff wearing our device. It's pretty much a condition of residency, and it's not out of the ordinary. People are expected to wear it because it's also the door key in these electronic doors. That's how you get back into your apartment or condo. There it makes absolute sense. But now you suddenly go to a single senior living at home. There aren't other eyes and ears out there. There are families coming in all the time looking at them. And family wants to give this. You and I want to give this to our parents for our peace of mind. But you have to look at it from their perspective. And
those elderly folks can be really stubborn.
Absolutely. They may, first of all, be in denial that they need anything like that.
Right.
Even though you and I know better because we know truly what's going on.
Yep, exactly.
You might just feel it's a burden to wear it. I don't want to wear it, So you have to be really tactful how you go about social engineering them into wearing it. And the secret weapon I can share with all of your listeners is co-opt the grandkids. There is nothing grandma or grandpa will not do for grandkids.
Oh my gosh.
Granddaughter call and say, Grandma, you got to wear this for me. And she will wear it. I guarantee you.
I can just see your ad campaign in the future, right? The grandkids are on camera and they're saying, come on, Grandma, put this on for me.
It's all to keep them safe and all to keep them living long enough to see all the goals that the grandchildren are going to meet.
Yeah.
And, ultimately, that's what it's all about.
Sure. The other one that I think of is just the physician. When we were talking before, I told you that my 91-year-old grandmother lives with us. And I'm telling you, it doesn't matter what I say, but whatever that doctor says, I mean, you write it, you take it on a check and cash it at the bank. I mean, the doctor has so much influence, whatever that doctor tells her she's going to do, which also would be another factor at play with a B2B versus a B2B strategy.
Right. Exactly. You need a person in authority to do that. And also part of it is also, as we all get older, we live aspirationally. We say, we might want to do 2 miles of walking a day and stuff like that. And sometimes we communicate that way as well. And so we find a lot of seniors, when they're speaking to the physicians, are not necessarily upfront about how active they are or how active they are not. And so sometimes the physician is kind of operating under a misconception. The person is a lot more active than they truly are. The physicians need objective data as well to take care of them.
Sure.
And the physician telling grandma, you got to wear this because then I'll know a lot more about you if you're skipping meals or if you're eating less, and I can help you, live longer and make sure you can see all of your grandkids' goals. That's powerful, but the doctor needs the information. And that's one of the messages we are communicating in the B2B world.
Sure.
It's not only from the care side, but also from the payer side, the Medicare Advantage plans of the world. They are working in a capitated model where they only make money if they keep you healthy. The minute you go to the ER, they lose and they've lost all that year's money on you.
Yep.
And so they are very, very interested in learning more about what's going on in that individual's life and how can they help at the earliest signs of, fatigue or malnutrition or risk of a fall or risk of a UTI.
Yeah, absolutely. So Satish, I want to ask you, as you kind of think about the last few years of your journey, what do you think some of the decisions or strategies that you've deployed that have been just game changers for you?
I would say that the very first instance of this product where we put on the dominant arm and started tracking gestures of the arm, that is something that's very novel. There's still nobody doing that. So you're getting that actual fork lift to the mouth or drink sip to the mouth. That is truly a differentiator that still nobody has really caught up to. And we think that's a game changer because that's directly measuring a particular activity or behavior rather than using a proxy of saying,
sure,
you open the refrigerator door so I can assume you ate. That's the old world. And this, you're asking, did they eat or not? That's been a game changer. The other thing that really came to us, and this goes back that's the whole product market fit. Our original first version had an enclosed battery. And it would last anywhere from 5 to 7 days, but then needed to be taken off and put on a wireless charger to be charged.
Yep.
What we found very quickly was when it's taken off, it's very hard to get them to put it back on because they've forgotten about it and they've moved on.
Sure.
So our next iteration was a game changer where we made it a replaceable, swappable battery without having to take it off the wrist. And that completely changed the adoption rate because now there's no reason for you to take it off. And you look
that's huge.
You look at something like an Apple Watch, which you have to take off every night to charge. That will never work for a senior because what are they going to do? They're going to put it on the bedside. So when they go to the bathroom at night, they fall. They have no way of calling anybody for help.
I forgot to put it back on because it's on my charger on my nightstand.
Yep, exactly.
Yeah. Wow. So what have been some of the lows in your experience? I know a lot of people don't want to talk about it, but we all know that entrepreneurship is not all rainbows and butterflies. It is a tough gig out there. So what have been share, just candidly, some of those moments where maybe you thought this is not going to work or, whatever it would be. What were some of those examples? Yeah,
I think the earliest, there are always highs and lows throughout the journey, and we've been at it for 5+ years. The earliest lows were really around the gesture recognition. Can we ever get to a stage where we would have a high accuracy? And at the earliest stages, it was disheartening because we spent about 1.5 years working on that. There's a lot of variation in how people eat. So at the end, we had to come up with brand new algorithms that had never been done before and a machine learning model on our wearable that can actually track that. That could have killed the company if we weren't able to do that. But, we had all these bright PhDs and they figured it out. And so we were able to get there. Subsequent to that, the product market fit, all of those have been very good. Customer adoption has been very good. Pilot results have been good. I would, however, say the one area that is still somewhat of a struggle is getting the venture funding for technologies that are addressing senior care needs. If you are creating, I don't know, an Uber for cats, people are going to put hundreds of millions of dollars into it. But if you're doing anything meaningful in the digital health realm to take care of aging seniors, there aren't a whole lot of venture capitalists who are specialized in that. So there's not a whole lot of people you can go to, especially if you got hardware as part of your solution. It's nearly impossible to get funding in Silicon Valley. They really should rename it to Software Valley now. Because if it's an app, they'll fund you. But if it's anything to do with real, tangible stuff, it's very difficult to get that. And that's been a struggle. But now we are seeing more and more, a lot of the VCs themselves are aging. And now they're thinking about, well, how do I take care of my dad and mom? And so that light bulb has gone off. And so especially since about last quarter, 2019 through now, we are seeing big shifts in how people are looking at aging demographics throughout the world. We have people from all over the world now investing in senior care technologies, and it doesn't have to be an app because they all realize, seniors don't use apps. Maybe the new cohort of seniors coming through will use apps, but in general, it's difficult for them to use an Apple iWatch or an Apple smartphone type device or a smartphone app right now. So we are seeing a lot more influx of interest now.
What do you think is triggering that? If it's just happening last quarter, is there an influx of VCs that have just hit that point where they're taking care of their parents? I mean, maybe we don't know what the correlation is, but what do you think?
That's certainly one reason. They themselves are looking for their personal side of things.
Yeah.
But the other aspect of it also has been this real big increase in Medicare Advantage plans and the seniors in those populations and how it's based on keeping them out of the hospital. There's been a lot of high-profile IPOs in that space. I mean, you look at folks like Livongo and other big-name companies like Oscar, Clover, One Medical. These are all the companies that are coming into the space that are saying there is a really good big market in senior care. Prior to that, people kept thinking about, well, it's healthcare reimbursement. That's a ball of hair they did not want to touch because it's not a very clean reimbursement process. But now they're understanding there are different modalities. And then CMS, Center for Medicaid Services, has also been very, very forward thinking about this stuff. They've released new billing codes for remote patient monitoring that are no longer connected to chronic care management. So you have a whole slew of remote patient monitoring companies coming up, which traditionally monitor an individual, their heart rate, their weight, and pulse ox. But now they're looking and saying, wait a second, activity and behavior is the new vital sign. That's something we want to monitor. Well, who does that? The only ones who are doing that right now today is us. That's our tagline. Activities and behaviors precede health declines. We can catch that. And so there's been a lot of thinking about, you really have to think about the senior holistically, not just their vitals. You got to think about all aspects of their life, their social determinants of health. That is important. And all that has been codified under the Medicare system, under Medicare Advantage. So people are saying, okay, now there's financial support for innovation in this space. We should start looking and seeing who's operating in this space and who are the ones we should fund.
Yeah. I think there was also, a lot of VCs that thought that, because of the explosion of innovation in healthcare, that it was just going to be a guarantee, kind of a quick win. because there was good technology out there. And I think that there's been, from what I've heard at different conferences, this kind of PTSD around, man, I invested in all these solutions and it just didn't turn out right. The long sales cycles, the reimbursement challenges. And so the companies that you just listed, I think are phenomenal examples to demonstrate that it can be done.
Yes.
Yeah. And it is being done. And there's a lot of financial return on making these investments.
Absolutely. I think to your point, when that whole boom occurred in digital health a couple of years ago, it was all app-based.
Yeah.
There was an app for everything. And what people didn't realize is app is only one part of the equation. You need coaching behind it. I mean, you look at Livongo or any one of those guys, it's not just a diabetes app. It has care coaches behind it, real humans that are giving very concentrated one-on-one attention to that individual with that condition to help them change, the outcome. That takes a lot of money to do that. It's not just an app that does it. And so I think they kind of had a little bit of a reckoning where they, doctor is not going to prescribe 500 apps for you.
Right.
A lot of these apps that are just languishing in the app stores with nobody using them. But those apps that have put themselves into the workflow of the traditional clinical model, put human resources behind it for the care coaching, and close the loop between the symptom and the treatment, and actually measured everything, they're doing well. And they're going to be just great going forward.
Sure. That makes sense. So let's talk about some other strategies that you think have been influential in your success and where you are today. I see that you're getting a lot of media attention and you're winning all of these great awards. How do you think that this is affecting your commercialization process? Or is it?
Yeah, awards are wonderful. We love them. CB Insights Digital 150, top 25 companies in the world for AI, and the CB award. They're all wonderful in raising the profile of the company. But to be honest, I don't know necessarily that they influence our end user customers. These are folks in the healthcare world who are looking strictly at outcomes. So another thing that we are very proud of is a 24-month outcome study that was performed by one of our customers, where they deployed our product in 3 facilities they had and measured it against 3 facilities that did not have our product over a 24-month period. And with our product, they found a 37% reduction in falls, 21% reduction in hospitalizations, 85-day increase in average length of stay in these private pay facilities where length of stay needs to be increased. That's where you want to be. You don't want to change care setting to an acute care hospital or a skilled nursing facility. That is really what is changing things for us. So we just started publicizing those results, and it's causing really big companies, even in the B2B space, to suddenly stop and say, wait a second, this is important. We need to look at it. We're talking with Medicare Advantage plans. We're talking with senior group living. We're also talking with very large health systems, as well as healthcare companies out of the valley. Very, very big companies that are suddenly saying, this is important. You actually have demonstrated results over a 24-month period. That is the gold standard in healthcare.
Yeah.
Awards are wonderful. I love them, but I'll take outcomes every day of the week.
So I think that is really important story as well, because, as an entrepreneur, and this, you wear many hats. And a lot of times you're bootstrapped, self-funded in the early stages. You can only do so many things, and you can get pulled into pitches and, media opportunities, and, just trying to determine how much time do you spend on that to elevate the presence of the company in the marketplace versus putting some money, time, and attention behind something that's really tangible, like an outcome study.
Right. Yeah. Absolutely. I mean, all attention is good, and we still love all that.
Right, but of course.
The study is an objective way of looking at it. I mean, if you look at some of those companies I mentioned, their earliest outcome studies were 30, 40 people using their product over a 6-month period, and them demonstrating that efficacy. Mm-hmm. That, more than anything, is what leads to adoption and success. Because healthcare, as we mentioned, is a highly risk-averse industry for good reason.
Yep.
They want to see that this works and you're not just using their patients as guinea pigs.
Yep. Well, I think across the world in any vertical, just as consumers, we don't believe what brands say. We only believe what other people say about those brands, right? Google reviews, Facebook reviews, et cetera. And you think in healthcare that it's really the data. So one of the things that I think is really important to stress here is this 24-month study. So not only are entrepreneurs facing long sales cycles, but if the key to successful commercialization is the outcomes data, and it took 24 months to get the study in place, then you have a pretty long run rate.
Absolutely.
And plan for that.
Yes. Yeah, absolutely. If you're doing anything in healthcare, plan for it to cost twice as much and 3 times as long. Whether it's sales or whether it's development or what have you. And especially if you got hardware, add another 3x multiplier to it.
Definitely. So I have thoroughly enjoyed this conversation today. I really appreciate all the insights that you have. I just have one last question for you. There are many health innovators that are in our audience listening today. Is there any advice that you would want to share with them before we wrap up?
Yeah, I think one bit of advice, and this was regarding our fundraising journey, is in healthcare, you want to raise as much as you can. We did it somewhat differently. We only raised enough to get us to the next milestone, and then we raised again, and then we raised again. As an entrepreneur, that's tying you up a lot into the fundraising cycle, so you are not out there leading the company, really pushing the innovation and making the sales.
Or selling.
Yes. And that really takes you away. If at all possible, get outside money in early. Okay, it's better to grow the pie than worry about the slice size. Mm-hmm. I meet a lot of entrepreneurs who say, well, I don't want outside investors because I don't want to give up, equity in my company. It's the wrong way to think about it. Think about the equity as coming with expertise. It's not just money, they're bringing connections, and the whole pie is getting bigger. And having that war chest in your bank is going to really serve you well in the healthcare space because it is a long sales cycle. It is a long outcome study sales cycle. Mm-hmm. So you really need to bank on that. You need to bank for it.
Awesome. That is just brilliant. Thank you so much for sharing your wisdom with our listeners today. I really appreciate it.
Thank you very much, Dr. Moore.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.